Welcome to another episode of the Let's Get Comfy podcast. Your home for love, peace, joy, but most of all, comfort. I am your host, Norman Harris, sole proprietor of the Let's Get Comfy podcast, but also the CEO and founder of Comfort Measures Consulting. Thank you, Comfort listeners, for joining us again. I have a special surprise. Special surprise for you today. Someone that's going to be sharing their insight and expertise, but also an entrepreneur, right? A woman of power, a woman of vision, and she's going to share her insight, her journey with us today. And I thank you so much for joining us, Dr. Yvette Guzman. Thank you, Miss Yvette.
Thank you for having me. I'm excited to be here.
Yes, CEO of Olive Health. So thank you for joining the podcast. And I'm just going to start off just natural. Just tell me about, what you do and just, what you provide to our community.
Absolutely. So Olive Health, we're a mobile primary care practice. Mm-hmm. We were founded 5 years ago in Tampa Bay. And basically, I wanted to help people that were at home that couldn't get out to their healthcare appointments easily. So I really wanted to focus on elderly individuals and individuals with disabilities. And when I started the company, I was volunteering with the Special Olympics, and a lot of the individuals that were on the teams that I was volunteering with, they were having trouble even getting their physicals done for them to be able to participate because of issues with access to care. And that broke my heart, hearing some of them waiting 2 hours in a waiting room to get a physical so that they could participate in the Special Olympics. So we wanted to bring something out we go to community events. So we'll go out to practices for teams and do physicals there. Mm-hmm. And then we also go to individuals' homes, and that's any age. And we also go to communities, so senior living communities, group homes for individuals with disabilities. So we're really just trying to be wherever people need healthcare to make it more accessible.
Right. And you target location here in Central Florida, Orlando market, and Greater Tampa Bay area.
Yes.
Yeah. So I noticed here too, just researching, you serve over 3,000 patients in the community. That's a large organization, and just from what you build up, your own platform and your team, that's very impressive. It makes me think, man, what did I do with my life? What did I do in my life? I want to be like Dr. Guzman when I grow up, right? But the accessibility of healthcare is a need. A lot of people, we have a lot of caregivers here that are caring for their loved one in home because of financial constraints in regards to meeting the financial capabilities to be in a assisted living facility. So you going out with your organization, providing that care is very important. For sure.
Absolutely. And that's really what we saw is, even people who are working from home, if they have an elderly parent or an individual, a child with special needs, they're still having to miss work to go out and take them to appointments. So now we can just come to their house. It makes it super convenient. And then, of course, they don't even have to be there. If the elderly person, lives with their kids and their kids out at work, we come in, we can call their son or daughter, during the appointment, and, they don't have to miss work, and everybody's getting the care that they deserve.
Okay. All right. So I want you to take a moment to brag on yourself. Right, brag on yourself. Talk about some of your accomplishments. It doesn't have to necessarily be awards. It could be just something just you achieved in life, just in general, that felt good to you as a person, but something that your family would be proud of you as well.
Well, there's so many things that I've, set out to accomplish. I've always been kind of a busybody. So even as a kid, I did, all different kinds of activities. But I'd say that my family is definitely super proud of the organization that we've built, and also that the focus that we have on providing quality care. So we're not just trying to see a ton of patients, but also making sure they're providing the best care. And that's truly what I'm most proud of.
You got hobbies, interests? What do you do for fun?
I love to travel. So when I'm not, working away, and I am super committed to seeing patients, we see patients in the evenings, on weekends, and things like that. But I do love to travel. I've been to every continent except Australia and Antarctica.
Wow.
So
yeah, I checked out your Facebook page. I'm not a stalker, but I saw all of those photos. I'm like, oh my gosh, she goes everywhere.
Yes, I really do like to travel. It's super fun. And
that's good.
that's definitely one of my passions.
This is really good. That's actually a passion of mine to travel, but I have to get to that point. I'm gonna do better at some point. So your team, your organizational structure with Olive Health, you can just really break that down for the audience, and give them a big shout out here on the show.
My team is amazing. When I saw this question, I was super excited because a lot of people ask me questions about myself and how I started the organization, but I couldn't have done it without the team that I have. Mm-hmm. So one of my really close friends, her name is Miranda. She's also an NP, and I always tell people she's the better half of this NP duo. So I'm a nurse practitioner, and I'm the one with a lot of the ideas, but she truly has a heart for patient care and compassion and attention to detail. So when I started the company, I knew that I needed help, and we had worked together before. She was the first person I thought of that I wanted to have on my team, and she's worked with me since the beginning. And like I said, she makes a lot of our calls out to our patients. She does televisits. She does in-person visits. She's amazing. Everyone loves her. She's super thorough. And then also a few years ago, my cousin, he's an IT guru. He worked for Verizon for a really long time. Okay. And we were trying to get an office business line set up. And I called him up and I was like, hey, I'm terrible at IT things. Can you help me with this? And of course he did it. It was perfect. And I was like, he had been doing the IT stuff for a long time. And I really needed somebody like that on my team to handle like business stuff and IT and all that. And so he joined our team. His name's Joel. And it's so great to have like a family member on the team. Cause there's just, you can just go to them and it's super close knit, like team that we have. So
that's really good. Yeah. That always is something to point for me as well is just with me building my organization. Like, I don't know, I just feel more comfortable with people that I can trust, around. I see that in some ALFs as well. Like they'll hire, some people that in their family members, but it really helps having that family oriented practice. Absolutely. And that actually feeds off into the care, and the customer service you provide.
Absolutely.
Because you sort of can feel how they feel, right?
Yeah, and you treat the patients as your family, really, and it becomes a family organization, and that's really what we're focused on for sure.
Good. So let's go over the services that Olive Health provide, just a list of services you provide to the community.
So our main service that we provide is primary care. So think of it as just a regular doctor's office, except we're coming to you. So that means, if you're feeling sick or you just need a physical, blood work, anything like that, we can come to your home, wherever that is. So that could be assisted living group home or an individual residence. And then we also do televisits. So televisits got really big during COVID, but they're definitely here to stay. They're not going away. Everybody loves the convenience. And we love to use televisits because you don't have to wait. We have a nurse practitioner that is available every day from 8 until 6 p.m. So we do the evening appointments too. You're not feeling well, you get to talk to someone on our team right away and get your medication sent in. We just love televisits. So we are constantly seeing that is growing. We also do community events. So we do flu shot clinics for assisted living facilities, senior communities, things like that. And then we also partner with a lot of organizations to do in-home blood work, x-ray. So really trying to bring you literally everything from a clinic standpoint to your home. In addition to that, and like I said, I'm one of those people who likes to do everything. We also do weight loss. So everybody's kind of big on the semaglutides and GLP-1s right now. And we see the benefit of those medications. Obesity is a huge epidemic in our country. So we definitely wanted to offer those to our patients. We didn't want them to have to go somewhere else for that. So we also offer those services. And then we also do aesthetics. So we do Botox, fillers, and we can do those in home. We can do a party for a group of friends. And I used to say, Botox parties. Okay. So I used to say it was only, I'd say like, oh, get your girlfriends together. But let me just tell you, there's a lot of guys that are really jumping on the Botox wagon. So
what the guys do?
Their forehead And yeah, a lot of forehead, to get it smoothed out. So really smoothing out the wrinkles, trying to look younger. We're all
So
trying
what you
to
think
do
I
that.
can do right here? What would you do to me? Because I, like, all my life I got this from my mom, like this line right here. So people think I'd be mad, but I don't be mad sometimes.
Yes, so that is what one of the main lines that everybody brings to us when they want to get Botox, and it just smooths it out. You just literally can't use those muscles anymore, so it would just give you that smooth fresh look. So
got it. Okay, I didn't know guys did that.
Oh
You
yeah.
just taught me something.
Yes.
So as you can see, audience here today, all right. Before I transition, that sound there is our time for our surprise moment. Surprise moment with Dr. Guzman. All right. So we're gonna interject now to start a little game here, and what this moment here is called moment of justice. All right. I know I didn't see this ahead of time because I want to see the raw report from you.
Okay.
Moment of justice means in healthcare, this is the question to you. In healthcare, if there was something that you are passionate about, that you passionately feel that you could change, what would it be? And I want you to get a raw report too.
Okay.
Yeah.
So I think the biggest thing that comes to mind is just like how healthcare has so many layers. And like, say I'm seeing a new patient, I don't have all the information about that person. Sometimes I have like, a couple notes from their previous doctor. Or if they were in the hospital, I might have some of the hospital summary, but it's like hard to get that whole picture of somebody.
Through the HIPAA law.
Yeah, you have to fill out forms, you have to fax stuff to, so many different places to try and collect that data. And I've seen that in some IT things that I've been reading about, is that that's really a big focus, is they're trying to create like almost like an Apple Watch or something where you can like collect your healthcare data on it, and then that way you'd be able to like have everything when you go to see a new doctor or something like that. And to me, that would just solve so many challenges that we have.
That's a good point. That's a good answer, actually. Thank you for sharing that. So if they come out with that, it would sort of be like a QR code or something. That if you could, that would go all to your medical record information. You know what? That, like a dot card or something. You heard of the dot card?
Yes.
So if you had a dot card, but it was associated with your medical history.
Yes. I need a medication list. That'd be great. One that's accurate.
Yes.
If I could have everything I wish for,
okay.
But I mean, I'm sure you see it too.
Yes.
In facilities and, the transition and, meds get changed and you don't get it updated.
Exactly. You're trying to, in skilled nursing, for instance, you're trying to admit a patient from the hospital, and you're like, well, we're waiting on the records from the doctor, or we're waiting from the case coordinator, waiting to get the records over. I know they have databases now like Aiden to assist with that process, but I understand what you're saying. Like it could be a faster situation, Absolutely. So that's a good point. At Comfort Measures Consulting, we're here to help you navigate the complexity of healthcare. If you're caring for a loved one as a caregiver, you don't have resources, you don't know what questions to ask, you need to have options, right? Give Comfort Measures a call. Give us a chance. First consultation is free. Speak with me, Comfort Measures Consultant, 850-879-2182. You can also visit our website at www.comfortmeasuresconsulting.com. Talk to you soon. All right, so getting back into the interview now. All right, unique approach. So you indicated the holistic approach to olive health, which is very good. But what do you see as a challenge to holistic healthcare?
The biggest challenge, I'd say, is that there's a constraint with insurance companies and their reimbursement. So they're really reimbursing to the healthcare providers pretty much a flat fee. So it doesn't matter how complicated or how much time you need. When you're setting up an appointment, you're really given, 45 minutes, max. And in a lot of doctors' office, they really trim that down. Sometimes you only spend 15 minutes with a healthcare provider. So we really try to maximize that. We do take a lot of insurance plans, and we try to provide the best care possible. We spend as much time as possible with our patients, but I'd say that's one of the biggest constraints, is not being able to spend enough time with the patients because of the insurance restrictions and the time that they're allotting for that visit and things like that.
That makes sense. Okay. So share with me just if you can walk us through a patient experience, right? Or share a story regarding just an experience that really touched your heart with a family member or patient.
Wow. Okay. Well, there's so
I know
many.
you probably have so many
There's
to
so,
share.
so many.
Yeah.
But I'd say that the ones that have really touched me the most, and I'll, make it general, but this is a lot of our patients. We have a lot of elderly couples that are still living at home, and the husband or wife is a caregiver to a sicker spouse. And we go into the home, luckily, whether it's the home health company or a friend of the family or a daughter or son that somehow finds us, we're always so grateful when they do, and they're so relieved that somebody is going to come in there. But we see, the struggles that they're having, trying to get all the resources, trying to navigate it. It's hard enough for you and I to navigate that, and we kind of live in that world.
Yes.
But for elderly people to navigate the healthcare system is pretty much impossible.
Right.
It's so complicated. There's so much stuff that's online now, and they didn't grow up with online stuff and portals and this and that.
Yep.
So we see that those patients really that are at home, that maybe they're limited caregiver support, or their kids are working, or they're out of town, they don't live here. Those are the ones that we are able to help the most, and they really touch my heart that we're able to make such a huge impact and make things easier.
Seeing that initial response from them when you come in and you answering all their questions or providing the things that they were in need of, right?
Absolutely.
I'm telling you, family members and just working with family members, it feels so good to them, just their reactions from my experience working in hospice. When you come in and you have answers, they really they really love that. What are some challenges outside of the insurance aspect that you touched on that you think caregivers face, and how can they address it? Because a lot of times, and I try to communicate to the audience, the caregivers out there, that one, they don't know resources that are available, and two, they don't want to reach out. They take the ownership of, this is my mama, I'm gonna take care of her.
Absolutely. Yeah, I think there's a lot of services that are underutilized. A lot of people are paying for insurance plans or have paid in. If you're a Medicare beneficiary, you've spent your life paying into this, and then you get to a time when you really need those resources, and it can be frustrating to sort of navigate that, because like I said, they don't make it easy. But really connecting with communities, reaching out to healthcare providers, whether it's hospice, home health, mobile primary care, it really takes like an army, but each person that you interact with will bring you more and more resources, because that's what we try to do. When we go in for mobile primary care, we're also looking at, okay, what about your pharmacy benefits? There's a lot of, medications that you could be getting. Can you get them delivered to your house if you're elderly and not driving? Or if you're eligible for home health, can we bring that in so they can help you manage the medicines or get you some therapy, things like that. So I think it's really about finding those resources and just continuing to reach out, because you don't have to do it alone. And I feel like so many people feel like they have to do it by themselves, and it's impossible. It's so much to kind of overcome.
Got it. What would you recommend as a way for family members or caregivers to actually access patient education? Do you have a resource to share at all?
Well, we do a lot of patient education. So that's what I'm saying. Medicare has a lot of programs. So we actually do chronic care management. So on top of the regular visits that you're having with your provider for acute needs, one of our nurse practitioners is assigned to your case, and she touches base with you a couple times a month for those chronic needs that aren't, really eligible for a visit, but are things that come up. So we do a lot of education about medications, interactions, and then preventative healthcare. So I think programs like that are amazing.
Yes. Yeah, preventative healthcare. That's a good point there. So sticking with preventative measures, because that's one thing that Comfort Measures Consulting, we try to focus on. And that's why I wanted this platform to have people like yourself to share those insights for preventative aspects. So how can a family member or caregiver or even the aging adult, the patient themselves, create a home environment that supports their health and the well-being of an aging adult?
I really think that there's so many things you can do. I think getting outside every day, moving around, whether even if it's just a little walk down your driveway, if that's all you can do, because I think people aren't getting outside enough, especially as they age. They tend to stay inside more, and that leads to a lot of disturbances with vitamin D deficiency and then also sleep disturbance. So I have a lot of people that are aging, they have increased sleep disturbance, but we're inside so much, we don't have that natural vitamin D and circadian rhythm. So I'd say, it really is the basics, but it's the things that we neglect. And I have so many people come to me and they're not feeling good. And we talk about their sleep and them drinking water. And I'm like, I can give you a handful of pills, but if you don't sleep and drink water, you're still not going to feel very good. And that's why I think that it's so important as we age that, we think, oh, we're aging, it's not as important to get active or go to sleep at night. I have so many older people that are watching TV or the news right before they go to bed. Like, I don't think that there's anything that'll keep you up at night more than watching the news or something like that. So I always tell them, like, can we change what you're doing at night, change your bedtime routine? And it's things like that that'll really give you longevity. I think that there's a lot of other preventative healthcare things, of course, like cancer screenings, skin cancer, colon cancer, breast cancer are three that we focus a lot on. And then, of course, diabetes and high blood pressure. But like I said, a lot of that goes back to getting good sleep and getting moving. So.
I don't know, but as just from your assessment, is it hotter now than it was when we were younger?
I think so. I'm not a meteorologist by any means.
I know. Just from
yours. Yeah, it definitely feels hotter.
Man, so. I remember one night we was driving from Crates, and it was like 10:30 around that time, and it was 91 degrees. Like, how is it in the 90s at 10:30 at night?
Yeah, it's crazy.
Yeah, it's crazy. So I just thought about that when you said getting that natural vitamin D. Do you offer or suggest any type of natural remedies at all or supplements?
Absolutely. So we go over supplements with our patients. We do a lot of testing. So we'll do blood work. We check vitamin D very often on our patients because, like I said, it's one thing that I'd say is overlooked a lot, but vitamin D deficiency is very prevalent.
Okay, good. So transitioning to community and community outreach, what are some things that Olive Health are involved in just out in the community, or just any partnerships with other providers?
Absolutely. We're huge on community resources and things like that. So we go to community fairs in Hillsborough County, Pinellas, and Pasco. Anything we get invited to, we'll definitely send somebody to. We also take students. So students from any university, we have, opportunities for them to shadow or precept with us. We love doing that. And like I mentioned before, I'm super passionate about the Special Olympics and individuals with special needs. So me and a lot of our other providers volunteer for their events. They always need medical staff there and things like that. And in the elderly community, in our assisted livings, we're always trying to do activities with them. We actually recently did a great activity. It was about water drinking, because a lot of people, as you age, you also don't feel as thirsty. You're naturally you don't get that sensation as much. And so we did a really fun, it was like a happy hour themed event for a senior living community. And we had a bunch of those like flavoring things for water. And then we got like little umbrellas and everybody was having their little mocktail. And, just found it easier to drink that versus a cup of water. But it was literally just water with a little flavor in it.
Flavor. So. All right. So for patients and families, why is Olive Health the best choice?
For patients and families, like I said, we just try to provide really compassionate care. And like I said, we try to give you as much time and attention as you need and deserve. And that's what it's really all about, is having healthcare providers that'll listen to you, that'll go to fight for you when you have to get those things that maybe are more complicated to navigate. And we really try to be diligent and follow through on those things that we know mean the most to our patients and families.
Okay. All right. We got a special gift for Dr. Guzman for coming on to the show, my baby girls. My baby Melanie.
Thank you so much.
All right. There we go.
Thank you.
So
Thank
thank
you
you for
so
doing
much.
this. I know you
Absolutely.
drove way over here at Zephyr Hills Boondocks to join the segment here. So I'm greatly appreciative for you having me and just engaging. Now we've been actually communicating for a while for you to have the interview, but you stayed on. You stayed the course with me and giving me an opportunity on this platform that is new.
Absolutely.
Right, newer, and you were a well-established person. So this means a lot to me and my family. So from the bottom of my heart, I'm very grateful. So thank you so much.
My pleasure.
For younger students out there, I know a lot of my target audience are individuals our age, up to aging adults. But if you were talking to or speaking to, and I know you do a lot of work with you as students, if you were speaking to a student, Junior Guzman, a junior Yvette Guzman, what would you say to them?
I would say to them to dream bigger. I think that when we're growing up, especially when we're in college, it's like this set sort of track that we're supposed to go on and kind of these milestones in whatever career you're kind of going in. And I think that can really hold you back. There's so many more opportunities. Being an entrepreneur is something that I never thought about when I was in college, but I think it's super rewarding and you can be more creative and create your own path.
Yes, good. That's wonderful. Wonderful. Anything new with you in life or family life? What's just give us a little spiel on the family life. Where you from?
I'm from Plant City, so I'm also from a small town. So coming to Zephyr Hills wasn't too different. But I love where I'm from. I actually worked at the hospital in Plant City. That was like,
was it South Florida Baptist?
South Florida Baptist. So I love that I came from a small town and I had a ton of opportunities there. Luckily, my mom was also a nurse, so I've grown up in healthcare. But
you did good, Mama.
No matter what your background is, whether your parents are in healthcare, whatever they're in, I feel like you can do whatever you want. Neither of my parents are entrepreneurs. And to be honest, they were a little scared when I told them I wanted to start my own company because, parents, are used to, the same thing. They're used to you being on that path and they want you to be safe and have expected outcomes. But, they have seen so much joy from, seeing my company grow and they'll go anywhere. Like just this week, my mom was at Sam's Club picking up stuff for Assisted Living Week and things like that. So, it really is a family thing that we get to support and create. So
awesome. That's wonderful.
Yeah.
Family story.
Absolutely.
And that's you did really good for yourself. You really did, and you had a great example, in your parents, but you took it to another level, and you should be proud of yourself. I'm proud of you.
Thank you.
And I know our audience is for what you do and how you're committed and dedicated. Is there any new initiatives or any long-term goals you all have set for Olive Health?
Absolutely. We're always wanting to innovate and help more people. So I'd say our biggest goal is to continue to spread the word so that more people can access our resources for them, whether they're in the home or in an assisted living. And then other goals that we have is also to meet with those insurance companies and talk to them about the struggles that their patients are having because of the restrictions that they have. So that's something I'm super passionate about, is getting up to that legislative type level, and also those insurance companies and those people that are making decisions and letting them know, like, some of the things that they're putting in place are actually hurting the people that they're supposed to be helping.
That is a wonderful point. Wonderful point. So I think Olive Health, in my personal opinion, is a wonderful aspect of our community. And for it to have, and just thinking of your origins, your story, your journey, is a great example to the youth and other individuals that want to aspire to just go out and do things on their own, even if you're changing, your lineage. You're the first, doing it. Same with me, with this podcast. It was a risk. It was just saying, man, are you really going to do it? Because you hear it all the time. Every time I used to tell people I'm going to do a podcast, they'll say, oh, I was going to do one too. But everybody was going to do one. But just taking that step and doing it, it's a lot of work. Absolutely. It's not as easy as you think. And also, I always tell my guests, like I told you before the show, I tend to be the one to mess up on the podcast, not my guest. So, and like you doing marvelous as well. But it just takes a leap of faith. And I remember me and my wife, we went to New Orleans for what's it called? Um, what's the festival in New Orleans? Essence Festival. We went there, and just to see all of the entrepreneurs and the owners, I spent a whole lot of money just because it's just supporting other individuals that are like-minded, and just seeing, because I understand the risk, how hard you have to work, the nights you have to stay up late that people don't see. Right, I'm sure you do a whole lot of work behind the scenes.
Absolutely.
That people don't even see. So it requires a lot. So again, big shout out to your team. I made sure that I wanted to add that in the show because I know it takes a team to build something in which you have established. So you all are doing a wonderful job in what you do for the community. So continue to work. I look forward to the growth as you've indicated of speaking to some of these decision makers to sort of improve healthcare, the insurance aspect as well. So I thank you, our Comfy listeners. I really appreciate you all for joining us today. And I wanted just to ask before I conclude, is there any final words you want to share with the audience at all? If you would, you can share your socials and where they can reach you at, locations, all of that, please.
Absolutely. So for anyone interested in getting more information about our services, our website is Olive, OLIVE, health, FL.com. So FL like Florida. And then our office number is 813-417-4767. And on the website, there's an intake form for new patients or a request for information. And then if you call our office, you'll talk to one of our amazing medical assistants and you can get any questions answered and they can kind of walk you through the intake process. So I'd love to help anybody out there in need, or if you're a community member that has an organization that needs something, you can definitely reach out to us as well. We'd love to collaborate.
Comfy listeners, Dr. Yvette Guzman, Olive Health, they have your back. Thank you for tuning in. Like, comment, subscribe. Also, we're on YouTube at the Let's Get Comfy podcast. We're trying to get our subscriptions up, so please support. You also can locate us on Comfort Measures Consulting on Facebook and Instagram as well. Also on my LinkedIn page, Norman Harris. So please support. We try to build up a platform that provides entertainment, but also education for listeners, for the audience, that provide them information and resources that they can that can benefit them from a preventative health standpoint. That's the passion of Comfort Measures Consultants. Like-minded individuals like Dr. Guzman as well. We'll continue to have them on the show. All right. So please support. I know you like watching Law and Order. I know you like watching what are all those other shows and drama shows. Let's add us in there. Sprinkle us in there just a little bit. Tune in. Thank you.
Thank you.
Thank you for watching.
Thank you for watching.